call, multi-agency call out of the EOC on Wednesday that our 7-day average, daily average of positive cases was 51. And I just want to say that again, 51, because it is the first time that we have been at that number since June 1st, which is more than 2 months ago. So I just want to Rod, Dr. Akinboyo, Philip, Katie, everybody who is working on this from the public health side, and then of course everyone who's out in the community, Pilar, and everybody who's working, Ryan, I just could go on and on, but team effort is paying off. And we just have to hope that once we have all of our wonderful students back in Durham, that they are just gonna get back on the bull with us and help us keep our infection rates down. Also, I don't want to steal Rod's thunder, but again, I'm just so proud of the Holton site and the model of what is happening there and how that is really serving the community. I think you said, Rod, that something like 70, I don't remember the exact number, but I think it was over 80% of the people coming there were from the Latinx community. And you can correct me on that number later, but just, it seems a place that people feel comfortable coming from the community and getting tested and then going back to and telling their friends and family that it's a good place to go. So that's really important. Bull City United, who are our violence interrupters, they have started a new partnership working with Cure Americas that Rod can also speak more about. But again, very exciting that they are working on the ground in the community, helping to share information and resources. I'm really excited about this because they were really sidelined with the virus doing their work, and I'm so glad that they are now back out in serving the community. We got an update from the Department of Public Safety hotel that is going to be opening in Durham. And again, I think things are moving forward in a positive manner with their staff really working closely with Durham County staff on that. One negative thing is that we found that we won't be able to have some rooms in there for some of our COVID positive, fragile folks. And so we're still struggling with finding a place for people who need to be isolated. And so I just want to put this out there as one of these things about thinking to the future, that I really feel like we need a different strategy around this, because it is really frustrating to me that we've also spent about $3.5 million for probably about 150 homeless people in our community. And it just doesn't seem that we have an effective way to deal with some of these needs. And some of it is related to the funding streams and how you can and cannot spend money. Durham Public Schools is waiting on a waiver from the USDA so that they can be able to continue their feeding program when schools are virtual. This is really, really important. That's because of that waiver, we were able to have the money to do that incredible Durham Feast program and feeding families and children, when school closed down in the spring. And then we've been relying on the summer feeding program. So that is so linked to the federal funding, and we're still waiting on that waiver. We also found out, the mayor and I were in a meeting with Durham Public Schools, this week, a leadership meeting, that they really need help with funding for the hotspots. They have spent $9 million to buy Chromebooks for all of their students who need them. And Geoff is one of the leaders of this campaign through Bull City Schools, the Hope Network campaign. And they've spent $1.6 million for about 6,000 hotspots. But now they have found that they need an additional $1.25 million for another 3,500 hotspots. And they don't have that funding right now. So this is going to be really critical, very important that we find the money for this in the community, institutional corporate partners, city or county. We've got to find the money. I'll let Steve talk about the conversation with Duke because I was really only in it for a short time, but I know we had a great conversation with Duke leadership this week around their reopening plans. I do want to share the news that on August 4th, the county, we found out on the multi-agency call that the county has received $3,309,388 additional CARES Act funding dollars. The city has gotten $2,930,034 CARES Act funding dollars. And I know on the county side, we have to present a plan to the state by September 15th. So they don't give you a whole lot of time for that. And I don't know what day the cities, I think the cities is due even more quickly than ours. So that's good news. We've got a little bit more money. And then lastly, the governor has extended phase 2 to September 12th. And there was an announcement about the state joining in a compact with 6 other states for us to get 500,000 antibody tests, rapid tests, and Rod may know more about where that stands and how that impacts Durham. And then I will let Katie and Maticia talk about their budget request to the city and the county, which also happened this week. So that is my report for this week.
Wendy, great report. I think that what I'll add is our discussion with Duke, which I thought went very well. We know that students are coming back. We've seen in Chapel Hill that there's been a letter from the public health director in Orange County and the mayors asking the universities not to come back. This is not happening, folks. The universities are coming back. The Board of Governors have said that the universities are coming back. Duke is coming back, and I think that our job here is to do the best that we can to make that safe for everyone, as well as to try to support the universities in everything that they're doing. Some of you all have students who are going back to college right now. This is important that our students get an education, and we're going to do the absolute best we can to support the universities when they're here. We had a good talk with Rod. I'm so mixed up on my days. I think it was yesterday, where he talked about his close working relationship with the universities, and we have had that, and we will continue to have that. We talked earlier about the NCCU plan. Let me just say a little bit about the Duke plan. I think that you all know some of the details. First of all, let me just say there is a great FAQ on the Duke website. If you really want to know what Duke's up to, they've done a great job making this public. And I recommend that everyone take a look at that if you're interested in Duke's plans. Here are some of the highlights. One is everybody who will go back on campus needs to sign the Duke Compact. As a visiting professor myself at Duke, I actually had to sign that compact yesterday, so I know what that's like. I now have to sign up also for the symptom monitoring app, which all students will have to avail themselves of, and all faculty members as well. Anybody that's on campus will have to be using the symptom monitoring app and reporting their symptoms on a regular basis. All students will be tested before they can, and faculty, before they can get back on campus. And between the time that they arrive and are tested and the results of that test being known, they will have to quarantine themselves. But this will be brief. The students are, the test results will be back. I believe that the goal is 24 hours, but I know that it's a very quick time turnaround. One of the things that is happening, which I think is a real, I know is a real change for Duke, something those of us in the community have wanted for a long time, but is now happening, which is Duke is going to now require all of its students living off campus to report where they live, so that Duke will know where students are. That has been something we've wanted in the past because of issues with Duke parties in neighborhoods, big parties, but this is, of course, parties now are very different. Parties now mean people can get sick. And so this is, I think, a very important addition to what Duke's going to be doing. Another aspect of Duke's program is that it's got very strict consequences for students who violate the Duke Compact. You can see it's kind of an escalating series of consequences if you look at the FAQ, all the way up to not allowing students to return back to the university. Students will not be able to travel out of Durham during the 3 months they are here. They will be required to stay in Durham unless there are, of course, exceptional circumstances. And so this is, I think, also a really good addition to the things that they're doing. I think that I've hit most of the highlights. I think that Duke is extremely well prepared. There are other people on this call who today or at this meeting today who may remember some of the other things, but I think that they're very well prepared. I think they're taking all of the issues that we're concerned about extremely seriously. And they share our concerns about the off-campus parties, as do our friends at North Carolina Central. And we're all going to have to be monitoring that very closely. The last thing I'll add about Duke, and I think is important, is they are going to have a hotline. And that hotline will be where anyone can report if they see a Duke student. You know, for example, if there's a big party in the neighborhood, the Duke will have a hotline, Speak Up Duke, I believe it will be called. And that hotline will be available to anyone who can report to Duke anything that they see where there are violations. So the students are coming back. It is a reality that we face. It is a difficult reality, but I think that our universities are very well prepared. Duke is extremely, compared to North Carolina Central, Duke has a lot of resources. And some of the things that Duke is doing, we know aren't really possible at Central at this time. For example, the level of testing when people come back on campus. So we know that there are differences in the resources that are dictating different kinds of responses. So again, that's something that we're going to have to be paying a lot of attention to. We do think that there are some things that Duke offers that we want to also talk to our friends at Central about. For example, the hotline. When we were on that call, we realized that that was a really good feature of Duke's plan, and we'll be talking to Dr. Akinboyo about the possibility that Central might be able to do the same thing. And so thank you all so much for all of your work all the time. It's been amazing. I'm excited for Katie and Maticia to report about how things went at the City Council and the County Commission because they went well, and just want to appreciate them for those great presentations and others who were present that day. Thank you.
Thank you, Mayor Schul and Chair Jacobs, for those updates. I'll spend a little bit of time now talking about the great fund that we had this week presenting to our county commissioners and city council. So Katie and I got the pleasure of making our formal request to the county commissioners on Monday and to the city council on Thursday. We were supported by Ryan, Brian, Pilar, Susan, and Marielle, so appreciate them being present to field some of the questions. Overall, I think both meetings went very well. I was really impressed with the fact that both the county commissioners and city council seemed very knowledgeable of the work that we're doing as a task force. They were complimentary of the work, and they were very supportive overall of our mission. They asked some really good questions about the budget proposals. And just as a reminder, the 3 budget proposals that we took forward were the Back on the Bull communications plan, the community health ambassadors, and the risk mitigation fund proposal. My general sense, and I'll ask Katie to weigh in as well, they were supportive of all 3 of the proposals. Specifically for the Back on the Bull communication plan proposal, our ask was to fund that communication plan $264,000. And of course, we asked the county and city to split it 50-50. Based on my understanding of how the meetings went, I understand that the county felt comfortable with moving forward next week with asking for approval for $100,000 of our $132,000 ask. And they were comfortable moving forward with $100,000 with the understanding that we evaluate the effectiveness of the campaign. And if the campaign is being effective, they will reconsider contributing the additional $32,000 that we asked for. What I gathered from the city was supportive of the entire $132,000, and that would be moved forward next week on their agenda for approval. I'll ask Katie to chime in on the other 2 proposals that she had the pleasure of presenting.
Sure. Maticia, before Katie gives her update, I just wanted to clarify on the county side, the budget amendment that's moving forward on Monday at the board meeting is for $95,000 to support the campaign.
Okay, thanks for that.
Just wanted to clarify that for everyone. Thank you.
Okay, thank you.
And I believe that supports phase 1B and phase 2 of the campaign.
That is correct. Thank you.
Thank you. So the other 2 proposals that we put forward were the community health ambassadors. I think there was very good support for that community health ambassadors from both the county and the city, a lot of enthusiasm for the program, a lot of really positive comments about the importance of this and what it would mean for our community, and a lot of good questions about it. The county is supportive, but it's unclear yet in terms of what the budget would be for that and how much support there is, but there is support from the county for that. And on the city side, the city is also very supportive, wants to both, the county asked that UNC Gilling School of Public Health go back and sharpen their pencils and really look at how we could potentially reduce the overall cost of that program to some extent. And so the city is also waiting for that sharpened pencil budget, but was very supportive of moving forward on this and funding it. So I think overall general support there from both. And then on the additional fund for relief for our small businesses, I think I would characterize it as general support for that with a lot of questions. And as we took that proposal forward, we certainly shared that it was not fully baked, that there were a lot of logistics items that we needed to put in place in terms of coming up with a final plan for that, but that we as a task force felt that that was so important to our small businesses and had come up in virtually every roundtable as a need that we were bringing it forward at this time. So there is, again, I would characterize it as general support for it, but with needing additional information. And the city has asked us to come back in 2 weeks with additional information at their next work session to really hone in on those details and how the fund would be used, how it would be structured, and whether it is indeed going to repurpose some of the loan funds that have not been tapped into, as opposed to asking for additional dollars. I got the sense that there was more support for repurposing dollars than there was for adding additional dollars. Questions? Anything I missed on that?
Katie, I do have one thing to clarify. There are 2 items that are going to be on our consent agenda next in 10 days from yesterday, so August the
17th.
17th. Thank you. And those items are, as Maticia reported earlier, one of them is is to 132,000, I believe it is our half of the communications plan. The item about the health ambassadors is also going to be on the consent agenda for up to half of the requested funding. And I just want to make it clear that that's also on our consent agenda. We will be acting on that in 10 days. The up to has to do with the fact, as Katie said, that we're waiting for the additional budget information from Gillings. But the council was very supportive, and I think that the characterization that you all gave of the discussion about the risk mitigation fund was very accurate. I think that there is general support, strong feeling that we need to support the businesses, but also a feeling that the plan needs some additional work in terms of who would administer it, who is eligible, where the funds would come from. And so I think that your characterization of that is accurate, but I don't want people to get the impression on the task force that the council wasn't interested or supportive in general. And as Katie says, the council was very supportive, but we hope that in 2 weeks we can have a plan back that will be able to move forward, because we do recognize the sense of urgency for our businesses. But I just want to reemphasize that everybody, Maticia and Katie did a fantastic job presenting, just an absolutely great job. And so did the other people who were there to be supportive. So thank you all so very much.
Thank you. Are there any questions from that? Commissioner Jacobs?
Yeah, I just wanted to add that, so on Monday, August 10th, we will approve the 95,000 for the communications phase 1B and 2. And then on August 24th, and Jody can correct me, is when our staff is going to bring back the revised information and proposal related to the community health ambassadors. So I hope that we'll be able to even possibly take action at that time on the 24th. And obviously, whenever you have any revised information about the risk mitigation, feel free to let us know, and we'll put that on an agenda as well. But I just want to echo what the mayor said, that Katie and Maticia did a great job, and Jody and Susan and Pilar and Marielle and Brian and Brian were also there providing support for all that too. So thank you. And Rod was there because he's always there anyway, but don't want to leave you out. But thank you. Appreciate
Thank you.
all of your leadership on this.
Now, I'll add one more note about the budget process, because I know we've had some conversations about, this was round 1 and that there will be some additional proposals that may come forward. Just wanted to let the task force know that we haven't worked out the details on how that works, because, we're moving at lightning speed here. But Katie and I do plan to spend some time focusing on, what does that next wave look like, and definitely plan to consult with Chair Jacobs and Mayor Schul on, the timing, because we don't want to go forth with budget requests every week. I'm sure that wouldn't be acceptable, but just trying to determine, how do we move forward from this stage when we know that there's some additional funding requests that may be out there. So once we work out those details, we will share back with the task force to let you guys know how we plan to proceed.
If I can also add on the fourth proposal, of course, was for the face coverings for the transit buses, and the city did agree to go ahead and fund those. So that agreement was in place before we presented the budget. But I didn't want anyone on this task force to think that hadn't moved forward. In fact, I believe those masks are ready to go and be delivered, is my understanding. So should be getting those to the Transit Authority in the next couple of days. And they are working on installing the dispensers, the holders for those masks. So that was really important, I remember, from our discussion, because right now we do have residents who are taking one or more buses before they could even get to the central hub where they could pick up a mask. And so in terms of priority for really having the potential to impact and reduce spread, that was critically important. So before we turn to Rod, I'm happy to give just a brief update on the hospital metrics, which I say I'm cautiously encouraged on these. I almost hesitate to say them out loud because they are a marked improvement. So as of yesterday, between Duke University Hospital and Duke Regional Hospital, we had 40 COVID positive patients in our hospital. Last week it was 54. I can tell you that even as of this morning, we're down an additional 5 at Duke Regional. So we are really seeing those numbers from hospitalizations go in the right direction. Again, cautiously encouraged by that. We have 14 between both hospitals in the ICU. We had 20 last week. I can report that for the first time since probably April or March, late March, for a period of time, one day this week, we had 0 ICU patients, COVID positive ICU patients in our ICU at Duke Regional. So again, seeing improvement in that. And our 7-day average in terms of number of hospitalized COVID patients between Duke University Hospital and Duke Regional Hospital, 48.5, down from 64 last week. And we are at 87% capacity. So still maintaining right around that 90% mark in terms of overall capacity. And again, just a reminder that Duke University Hospital generally stays full regardless of COVID or whatever else is going on, because it is such a large referral hospital and as an academic medical center. Any questions on those before I turn it over to Rod? All right.
Good morning to everyone, and we are certainly going to keep the feelings of good numbers and good reports going. And as Katie said, I will echo that sentiment. I am cautiously optimistic as I give this report. We're going to continue to accentuate the positive. The number of cases reported this week has been rather low. For example, today's Friday, I believe Wednesday, we only had 28 cases. Thursday normally represents the high mark for whatever reason. And we normally, for the past couple of weeks, have seen cases in the 70s, 60s. Yesterday was 57 cases. That brings us to 425 active cases. I'm proud to report that 5,535 Durhamites have been discharged from COVID care. We did pick up 2 additional deaths since our last meeting last Friday. Major comorbidities, hospitalized for quite some time. So that brings us to 79 total deaths. So we're right at 6,041 total cases since the pandemic began. Between Durham County and CCNC, we've made 11,663 contacts for COVID care and everything. So we continue to move steady. As Chair Jacobs said, as of Monday, August the 3rd, there were 5,917 cases, and our 7-day moving average was way down at 51. Last week, it was 63. The previous week, it was 68. So far for the month of July total, there were 1,994 total cases. We begun August with just 128 cases. And as I've said so many times before, the 7-day average does let you know whether or not trends are increasing and decreasing. We're happy to report that they're decreasing or even flattening. So we'll continue to accentuate the positive. Latinx Durhamites still represent a little more than half of our cases at 50.18% for the month of July total. They continue to be overrepresented. Our Black African American population are underrepresented at 30.38%. And our white population continues to be very underrepresented at 16.26% for the month of July. So we continue to work with Pilar and all of our community advocates and our healthcare coalition to take care of our Latinx population and also to take care of all of our Durhamites. The sectors that continue to plague us continue to be unemployment, construction, and hospital work. And the percentages remain the same for the month of July, with unemployed individuals of the Hispanic population representing 59.4%, with 71.2% of them being female. As far as construction, there was 87.8%. Representing the Hispanic population, with 93.2% being male. And as far as hospital workers, as 40.2% of all of our cases, mainly representing the Black or African American community, and 70.7% being female. So we continue to keep our eye on that. As far as our surveillance data that we tend to get from 2 particular areas, that's our insured population and our community-based population, they continue to be rather low. 8% for our insured population and right at about 3 to 5% for our community base. So we still see all of our positive prevalence decline, but we still keep an eye on it because it's still hovering around 5%. As Chair Jacobs has said, we continue to have great results with our Holton site. And, for the most part, we're really excited about what we're doing in terms of being able to quickly get close contacts to testing and provide the resources in the form of educational material and food for food insecurity, and also masks. So we continue to work well with that. I will say that we are seeing a decline in individuals who are needing testing. And we are still trying to analyze, and I said we, local Durham and also the state are really trying to analyze what's the reason, what's the rationale. We don't want to attribute it, ladies and gentlemen, to COVID fatigue, but the numbers are kind of down throughout the state, but it's particularly noticeable in Durham. Some additional statistics for you. With Holton, we have been able to see right at about 737 individuals have been tested since we began our great partnership on July the 11th. It has resulted in a positivity rate of 25.51% per this one unit. And that lets us know that we're definitely steering people in the right direction. And as far as the number of contacts that actually go and get tested at this site, it's 75%. So that is phenomenally good. And we will endeavor to continue to keep up the good work. As also mentioned, Duke's model did indicate that we are continuing to move in the right direction, ladies and gentlemen. Duke's model for this week, apologize, I'm a little all over the place with my notes. But Duke's model did indicate that we were at 0.7% growth rate, whereas North Carolina's growth rate was 0.9%. And also over the past week, North Carolina's infections have grown at 10%, where Durham's infections have grown to 6%. So we continue to keep our foot on the gas, no need for us to let up. As Chair Jacobs has also mentioned, a great partnership between Bold City United and Cure Americas. That started on July the 30th. And we did have volunteers from Cure Americas to initiate with Bold City United new community outreach, in which Bold City United was able to connect with their usual target areas and geographical clusters of COVID cases. And the outreach really focused on contactless distribution of COVID-related information to include masks, hand sanitizers, children's resilience information, and really more detailed information and connections about two remote learning opportunities through Durham Public Schools. So it's a great partnership. And again, their target census tract included zip codes of 27704, 27705, 27703, all those areas that are so important to making sure that our Durhamites remain safe, and we're still able to touch on violence prevention efforts as well. Before I turn it over to my great partner, Dr. Ibukun Akinboyo, I would also like to say that we did receive and have received lots of media inquiries in reference to the letter that my great colleague, Quintana Stewart, Health Director in Orange County, sent to UNC, and to which we replied that we have never stopped being in contact with Central, with being in contact with Duke since March 2020. We have continued to remain in contact with them. We have worked with them through their through students leaving campus. We've worked with them over the summer as they planned and coordinated what their response and what back to school would look like. We have reviewed plans with them, and we have worked with them to ramp up to make sure that simple things like moving kids back on campus and making sure that staff and administration are safe. This also extends itself to partners that we don't talk about all the time, to include the North Carolina School for Science and Math. We do that as well. They're independent schools that we talk to. I mean, we are making sure that Durham is completely covered. It's a labor of love, because we want to make sure that our infection rate continues to be down. And we'll continue to partner with them to make sure that college students are squared away. We thank y'all for everything you do and your support. This time we'll turn it over to Dr. Akinboyo.
Thank you, Ed. Excuse me. Thank you, Ed, as always. Excellent summary there. I would support everything that's been mentioned. Overall trend is improving, yet this is not the time to peel back efforts just yet. We kind of need to continue, particularly with the upcoming changes in the next 2 weeks around schools, both for universities and also for elementary schools. And I mentioned this to Rod offline, but sometimes when we give the numbers, because we continue to count each case each week, we sometimes miss the good news that's embedded within there. So I like the new graph that shows active cases. Kudos to George for mentioning this at one of our prior meetings. And it shows the different humps we've gone through and how the curve is slowly going down. I think with data, we sometimes give worst case scenarios so we can all prepare, but I think this is a good time to pause and certainly commend all of the efforts that people have poured into getting us to this point, and continue to ensure that the next few weeks to months remain safe for all of us in Durham. So over to the leaders.
Thank you guys for those great updates. And it is encouraging to hear what, Ibukun, Rod, and Katie just talked about. It's encouraging to hear, and I think it's reflective of a lot of great work by a lot of people in Durham. And while it's encouraging to hear, it also, to me, says we can't take our foot off the gas. We have to keep doing what we're doing so that we stay on the trajectory that we're on. But before I move us on, are there any questions for Rod, Ibukun, or Katie? Mayor Schul?
Thank you, Maticia. Thank you all for that great report. I do have two questions, Rod. Could you talk a little bit more about the testing decline and put a little more context around that? And then my second question is, I know that we've had some people who have been, at times a large number of people who've been reluctant to respond to our contact tracers. And I wondered how that was going and what you're seeing now in terms of that, and are there things that we need to do to try to improve that? So those are my two questions.
Mayor Schul, thank you so much for your question. I'll start off with the last one and I'll go to the first one. Contact tracing continues to go extremely well, and we continue to be thankful for the partnership that we have with CCNC. As I've said so many different times before, we do have weekly meetings with them because there's some investigators and some contact tracers that are on site that have chosen to be with us in our agency, and then the majority of them are still off-site. We continue to really reap a great benefit of having them. And the last report that I saw, we were able to be right at about 80% of our contacts being accomplished. What does that mean? That means that 80% of the people that we called picked up the phone. They decided to take that call. They listened, and they now know that when we call, we're not just really calling and really just asking them questions. That means that we're calling and we're able to provide answers and resources that they need. So it was a long time coming, and as Maticia said, there's a lot of people to thank as far as making sure that we're able to provide that service for our Durhamites. As far as testing, I chose that to be the last answer because, to be honest with you, I don't really have a straight answer for you. On our weekly call with the state, they were asking us pointed questions as to why we think testing has kind of dissipated a little bit. And it's not for a lack of resources or reagents, if you will, Mayor Schul and others. We have the capacity to test. We have the ability to test. It's just that, we're not exactly sure why individuals are not being able to come up and just say, hey, I want to be tested. As Katie and others have attributed to, we're cautiously optimistic. And my health director colleagues and others have said that we truly think that this is the calm before the storm, if you will. We're going to continue to be optimistic, but we are taking these last few weeks just to really give our staff some respite. They've been working tirelessly. For those of you who don't know, we have a 7-day operation and have had a 7-day operation since we began. And I'm so incredibly grateful for our public health staff, to include Bull City United, Project Bill, health education. Every facet of our health department participates in COVID. And we will continue to make operations and testing available. We continue to talk with our vulnerable populations work group around ways that we can get the word out, whether it's one page or traditional health education methods. We try everything, and we really feel as if we have exhausted all avenues just to make sure awareness is there. So I hope it answers your question, Mr. Mayor.
Thank you very much, Rod.
Yes, sir.
I make one quick comment to that? So as we hit hurricane season as well, there are some testing sites that close down every so often. I don't think the data this week just reflects what occurred with the hurricane, especially at the coast. But just some awareness that as we have some non-COVID factors that impact tents that are used for testing or outdoor sites, there may be some fluctuation with testing. However, the overall numbers, our proportion of positives still continues to go down, which is a good thing.
And I just wanted to jump in for a second. One thing that I forgot to mention in my report is that DHHS has put out an RFA for $17 million worth of funding for communities to provide support for people who test positive for COVID. And there's been a lot of questions and interest about that. The grant, which is, it was actually due yesterday. People had to respond. It was very quick. And I think what I learned about that is that it was not something that Durham County could actually apply for, but they were looking for community partners. And I'm pretty sure last I heard was that Duke Community Health did respond. They had put us into a regional group with Vance and Granville County, I believe. So Durham, Vance, and Granville. But I hope that that we are successful in that Duke is successful in getting some of that funding, because that's going to be another way for us to support vulnerable members of our community. Part of it was not just for things like food and wraparound support, but also for paying support for paying people who are not getting sick leave if they have to stay at home from working. And we know that this has been a big issue with us, particularly our Latinx community, frontline workers who don't have paid leave. So I hope we get that. And the other thing I just want to mention, I don't know if we're going to talk about this later, Katie and Maticia, but the pulling together the education roundtable, and Rod mentioning North Carolina School of Math and Science was, triggered for me. Yeah, we should include them as one of the partners on that as well. So thank you.
Madam Chair, I'll just add that late breaking news, I did receive some favorable news in reference to the 17 million venture. We have a 1 o'clock, I believe anywhere from 1 to 2 o'clock conference call with Duke's Community Health Division to talk a little bit more about that. But so far, I believe that the news has been very favorable.
Thank you very much. And Chair Jacobs, we do have some time later on the agenda to talk about student engagement. How do we engage our student population? If there are no other questions for Rod, Katie, or Ibukun, I'm going to move us on to the next item on our agenda, which are our roundtable updates. And we've listed a couple that we want to specifically talk about, but we certainly have the space to talk about others as well. So why don't we start with an update from our community engagement team?
Good morning, everyone. Pilar, Quille, Amber, Linwood, and Constance from Neighborhood Improvement Services and I met on Wednesday. We had a very robust and deep discussion and came away with 2 items for your consideration. First, now that the task force will be a longer term body focused on recovery and renewal, it's more important than ever to have community rooted partners at this table and on our subgroup to make sure we keep the community voice and the priorities and concerns at the forefront of our work. And I just have to note that as our friend and mentor, colleague, the late Andrea Harris reminded us often, and as Constant echoed on Wednesday at our meeting, we need to make sure we have people at the table who are most affected. So the recommendation is that the task force consider adding representation from community-rooted partners, particularly from the African-American community, to this task force. So that was the first item for consideration. The second is that Constance and Linwood reported out on the very successful virtual town halls that they hosted in collaboration with Duke Family Medicine and Community Health this week for the Spanish-speaking community. They collaborated with several community-rooted partners to plan and publicize the event. And according to Linwood, there were more than 1,000 people who logged on to that Facebook event on August 4th. They reported that the participation was outstanding. People asked lots of great questions. The panelists were terrific. And so this is the kind of virtual town hall we'd like to plan for other communities as well, and particularly one that's focused on African-American community concerns, to allow people to ask their questions and get answers directly from decision makers. So those were the two items that we discussed at some length, and Pilar may want to add some additional comments.
Thank you, Lois. No, I think you've mentioned everything, and something we talked about, and I mentioned when we presented to the city the budget proposals, is our concern that we understand that we are targeting a lot of our efforts to the Latinx community, and we know for sure why. But also we don't want to forget the other minorities, because something we've experienced and I've been trying to work on is how to improve the relationship between African-American community and the Latinx community. And one of the issues we see is we feel we are fighting for resources. So this could increase the gap between the two communities. So we don't want to, this particular moment to, get in the way of improving these relationships. So I think we need to be careful with that. And it's why we need to also continue giving resources and thinking about how to continue supporting our African-American community.
Thank you so much for the update, Lois and Pilar. So I'll start with the first item and certainly ask for others to weigh in. And I promise you I was paying attention to the entire meeting, but I'm thinking back to the updates that we provided. I think one of the things that we had on the agenda, I'm not sure if we covered it, was the good news that everyone on the task force has agreed to stay on through May, which is very exciting because I think we put together a great group of community leaders, and you guys have been so engaged and accomplished so much over 80 plus days. One of the considerations that we had when we pulled together the task force was the number of people on the task force. And so I think we initially thought that maybe 12 was good. And then we, as we talked about the people that we wanted on the committee, we went up to 15. So we have 15 members and really want to keep that number static, want to keep it at 15, Lois and Pilar. So what ways do you guys propose that we move forward with getting some more representation from the Black or African-American community?
I have not given that deep consideration. Frankly, I feel like from my perspective, and having done some work around community engagement here, if it's a matter of trying to keep the number static, I am personally prepared to step away and have somebody who is much more involved in grassroots level and community-based work, come onto this slide.
Is it possible that, because I think about all the great roundtables that we've stood up, is it possible to get some of that insight via roundtable and have that roundtable actually present to the task force, allowing space on our agenda for that?
That's certainly a consideration as well. And I'm looking at others on the screen who are doing deep work in the community as and to get their feedback and suggestions.
We don't want to lose you, Lois.
So
And I
Make it
think
not
that
that
could
easy,
be,
Lois.
I think that could be one strategy to have in the roundtable. And we talked about this also in our meeting. And also as we are planning to have this virtual town hall from the immigrant and refugee community, doing it also for the community in general. So it's, as we were talking at the beginning about how communications should be the same time in English and Spanish, I believe we have to maintain that equilibrium for the whole community.
I think, Maticia, that maybe one good thing to do would be for Wendy and I to have discussion with Lois and others that she wants to include, and try to figure out this out a little bit. I'm happy to be part of that. I'm sure Wendy is as well.
Yes.
And I really appreciate Lois bringing this to us, the issue of the community rooted partners and how their voices can be better heard. But I think in terms of the membership of the group and so forth, I think there's some things we can consider. And I think maybe if we have a talk outside the meeting, Lois, a separate meeting, I think we can, and whoever Lois recommends, I think we can advance it.
Yeah, I'd like to include Constance had some, and Linwood had some suggestions too, based on their work. So perhaps to meet with you and Wendy and Pilar and Constance and Linwood.
That sounds great, Lois.
Thank you.
All right, awesome. We will take that as an action item to make sure that that happens. And then the other item, Lois, you talked about the virtual town halls. And so specifically, what is the ask there for the task force?
I think it's, I will continue to work with our small subgroup and Linwood and Constance, but it could be that we will need, expertise, some experts from this group, members of this group, to be participants and panelists, because it's my impression that the Spanish community one was very successful because of the composition of the panelists who were involved. They knew they were decision makers and trusted agents. So that may be the specific ask. Who from this task force should be involved and actually included in the planning of it as well, and promotion of it, as well as in actually participating.
Lois, are there learnings from that initial town hall? Are there, what was sort of discussed, and what could we learn from that?
Pilar?
Yeah, so I can tell you mainly was, again, was information about COVID and talking about, everything in general. But I think what was successful was we had physicians speaking Spanish, and not only Spanish, but the language the community could understand, and the different aspects. So people were able to ask questions, and the questions were answered in a way they could understand. So I think that was one of the successes, that it was really close to the people, more than experts saying, this is what is happening, this is how we prevent. And also, I think one point that Gabriela Maradiaga, the physician who was there, talked about was the, oh my gosh, how do you say, mitos, the beliefs you have. If I get too sick and get to the hospital, they are going to do this and that. So she explained that very well, because I think it's one of the things we were talking about for the Latinx community. People were waiting too long to get to the hospital, to the point that they were getting to the intensive care unit. So she explained all those beliefs. So I think it was very close to the community. And I think it's why. And also we spread the word and share it widely, so people participated in it.
I think for what I would envision for the virtual town hall focused on African American communities would be about COVID remaining safe, prevention, but it also could be about just decision making around how we are deploying resources, how we're thinking about the recovery, how we're going to focus resources in specific communities, and what does that mean for African American communities. So I think it's as I think about it, what it could involve would be about the direct impact of COVID regarding health, but also on communities beyond that.
Great, thank you. That's actually really helpful.
And I think
this is important.
Sorry, but I think that's what we want to do with the immigrant and refugee virtual town hall, bringing the different aspects and bringing decision makers so they can answer to the community the questions we have, mainly in education, housing, health. So I guess that one we can replicate it this would be in English, Spanish, and we are thinking French for the refugee community, but I believe we need to do another one.
If it would be helpful to have any back on the bull graphics to use for those town halls, let us know.
Pilar, I've heard you say, for the immigrant roundtable, as we're thinking about that town hall, we've talked a couple of times now about the importance of having it translated into French. Do we need to have any of our other materials translated into French?
Thank you for that question. Actually in our meeting yesterday, we are revisiting the French piece of it because Nayo, who is from the World Church Services, was saying he talked to some of the translators and people, and seems like Swahili, it's more common than French. So I think we are having that conversation this week and next week to decide, but that will be great. So we will let you know more details because we are finalizing those details.
Thank you.
All right, great. So Lois, thanks for bringing those two topics forward to the task force, and we will certainly do what we need to do to support both of the efforts as we move forward. Next update is going to come from our economic recovery team.
Hey, good morning, everybody. Thanks so much for having us. Thanks to both of the co-chairs for giving us an opportunity to kind of give you all a bit of an update. Just as a refresher, the team consists of myself, Anthony Nelson, Susan Amey, Pilar Rocha Goldberg, Nicole Thompson, Ed Boyd, and did I say Susan Amey already? I'm not reading from a script, so I'm off the top of my head. So anyway, there's the 6 of us that was born from this task force. And I think similarly, to kind of piggyback on what we had just heard from the other group, and just on cue, just so I could share this with you, the Symphony of Leaf Blowers has started off to my side here, so I'm sorry if I'm a little bit distracted, so we'll continue. Anyway, but similarly to what Lois was reporting out on, our group has talked a lot about bringing in additional stakeholders to our group, kind of beyond just the task force, to sort of widen and amplify how we can best align all the work that everybody's doing in the community together, but kind of get it into one space. So that's something that we certainly have been very, very mindful of too. As an update, we have been continuing to monitor, and thanks again to Anthony for keeping these numbers. I got an email this morning, haven't had a chance to look at that, but these key performance indicators, where this group started was, well, how do we measure what a recovery looks like? So we started looking at things like consumer spending and increasing, and how is that growing, if it's growing at all. Certainly the Back on the Bull campaign and the great work that Susan and that team have done has gone a long way to start to gain some of that confidence back. Business strength is another piece that we're looking at. Openings, is our revenues increasing? What are we seeing from foot traffic? The easiest one, the obvious one to identify is unemployment. And is that number decreasing? We're seeing it go down very, very slowly, but it is going down somewhat. Also, the wage, are those wages increasing as well? And importantly, what this group is looking at is monitoring what sectors are most impacted and negatively, and then what sectors are actually growing, and then kind of taking what we're understanding from hospitality and retail, but we're also seeing some biotech and life science and some manufacturing affected there growing. How can we connect those who have been displaced from work into new opportunities? So we kind of based everything in this group, although we've only had an opportunity to present or to talk to you guys 3 or 4 times. We've been meeting since the middle of March every single week. It's a very dedicated group that leaves our meetings every single week with homework, comes back and reports out. So the work is certainly like at this stage like a duck on a pond, with a lot of the reporting out still to be shared with you all. But from those good performance indicators, we started thinking like, well, how can we influence those? What kind of spaces can we be in? And so we broke that down to 3 major focus areas. It is that consumer activity, it is the employment, and ultimately it's business survival, growth, and promotion. So there's a marketing and a piece of that as well. So if we take those performance indicators, sort of think of it as a pyramid. So start with those KPIs, and then we have those areas of focus. Where we've sort of evolved into is, well, what specific concepts can we develop underneath the guise of creating those focus areas in that framework? And so where we met at the last week was, let's come up with some big ideas and recommend to this group. And so we started focusing around 4 major concepts at that point. One is the Rediscover Durham piece that Susan might want to speak to a little bit. Another is the placemaking component of it. The other one is sort of business development and job training or retraining. So it's that workforce development piece. When we just started focusing on the workforce development, we realized, well, we still need to do business expansion, retention. So we need to be growing the economy too before we can just focus exclusively on workforce. So we kind of created an overarching piece there. And then the 4th piece is the digital equity. It goes so much beyond just our schools, although that is absolutely critical, but digital equity across the broader Durham community to make sure that everybody, as we begin to recover, rebuild, retrain in many cases, we can do so in an equitable fashion. And given that we're going to be doing that very, very differently moving forward, we want to keep a sharp eye on that. So we're looking forward to actually reporting out the recommendations under those 4 different categories in the coming weeks. Susan and I and Anthony we're talking this week, and our schedules are a little bit starting to kind of trip over each other with who's going to be in and who's going to be away. But we're coordinating something, and we intend to have something to you all for a formal presentation from the team by the end of this month, certainly before the first hammer. So happy to answer any questions. Also would love to kick it over. I've been talking a lot, but it's an absolute team effort. So if anybody from the Recovery Task Force would like to chime in or add on or correct or anything like that, please do so. And we're also all happy to answer questions. Thank you.
Thanks for that great update, Geoff. And I think having those KPIs identified, and I think you said the timing would be around the end of this month. It feels like the timing is right as we close out our initial 100 days. And I don't plan to start, count beyond 100 because I'll get confused. So we'll start counting again. But I think it'll be a great measure for us to have as we close out our initial 100 days and go into our new days of task force work.
One thing I would add into what Geoff was saying is the Rediscover Durham campaign we have mentioned before, and that's something that Discover Durham already has planned and ready to roll out when it's time. But I noted on the presentation to the county commissioners, this issue came up. It's come up in some other conversations about when we start transferring from messages about be safe and stay at home into come back out, make sure that you're visiting our businesses. And right now we do that in asking people to get takeout and to order products online. But the full-fledged message about it's time to come out and support businesses and engage with them. We're going to be really thoughtful about when we start to move over to that messaging. And so I think this Rediscover Durham campaign and the Back on the Bull campaign may converge. I would hope by sometime this fall. where we can start transferring the back on the bull messaging into a let's get out and visit safely. So there'll be more to come, and that's part of what you'll see evolve from us over the next few months.
Thanks for that, Susan. Any questions for the economic recovery team before we move on?
I just wanted to say I really appreciate the work that you all are doing. It's really, really important. Your recommendations, I'm really excited about just the 4 big takeaway areas that you just talked about, Geoff, and just knowing that we have people who are kind of stepping aside and you all really looking at the numbers and thinking about this in a systems approach is really helpful I know to me as a county commissioner, because this is going to be just such an important part of us not being reactive, but proactive in thinking about the challenges that people in our community have right now and ahead. So I'm just really grateful to the work that you all are doing. Thank you.
And I think one of the key things that I heard you say, Geoff, was establishing these KPIs and figuring out how we influence the KPIs. So I really like that we're going to have something that we can target to say we want to influence that, and it's something that we can actually track and monitor. All righty.
Appreciate those comments. Thank you.
So seeing no others with questions, I'm going to turn it over to the communications team.
Hi. All right. I'm going to talk a little bit about the Back on the Bull campaign and where that stands. And I don't know if Marielle would like to talk about the website and what's going on there. We've moved in, of course, into execution mode on the Back on the Bull campaign. We've got phase 1 has been deployed with the exception of bus advertising, which I understand is being reviewed at the city. There was some concern about the messaging for the bus advertising. It is focused on wear a mask, and Go Durham wanted to make sure that it was clear that you weren't going to be prevented from riding the bus if you weren't wearing a mask. So we're trying to fine tune that. But otherwise, everything has been pushed forward. The timeline that we have for approval of the phase 1A and phase 2 funding for communications should be consistent with when we plan to roll those out. So we're not anticipating that we'll need to put in any pauses waiting for the funding, provided we follow the schedule that's been discussed so far. So we'll be rolling out over the weeks of 8/17 and 8/24 with the next steps, which will include print, radio, social media, television, the rest of the channels that we intend to use. The communications team is continuing to meet, and at this point are looking for what various ways are of continuing to build partnerships and push messaging out through different means. In the last discussion, it was talking about whether we should consider yard signs and whether we could work with grocery stores for them to use signage. So looking for some things like that, and also very cognizant of the need to work with the universities and schools on signage. So, and we have representation from both Duke and North Carolina Central on the committee, and reach out to Durham Tech as well to make sure that where there's opportunities to pull that messaging together or to share resources with them, that we will do that. And I think that is, yes, I think that's all, unless you have any questions. And I'll turn it over to Marielle if you'd like to talk about the website.
Sure. Well, I guess we'll pause for questions to Susan. Okay, so I'll just give a kind of a quick update on specifically the business checklist part of the website. So we we're actually approaching 300 unique businesses that have completed the checklist. However, I think a really important note and something that we need to dive in and understand a little bit better is that Many of them are actually asking not to be shared publicly on the website, which is why we're not seeing 300 businesses on the website. So I think that's something that's really interesting to kind of follow up. The majority are still asking to be shared on the website, but there still is a sizable population that's not. So I think that's something to follow up and dig into and understand what are the barriers that and the fears that maybe some businesses have about having that be publicly available. And then I would note that, probably unsurprisingly, it continues to be difficult to reach primarily Spanish-speaking businesses. So of the checklists that have been completed, 99% have been completed in English, and only 1% were actually completed in Spanish. So I think that's a clear area that we need to continue to focus and encourage and promote. The most common business type that's getting selected is other, which is very interesting. And then when you actually read the text that people put in for other, it's really wide ranging, which is also, I think, really interesting. It stretches from, car wash to, house call veterinarian, nonprofit, brewery. So it's actually pretty wide reaching in the different types of businesses that are actually completing this. Of the actual business types, the next most popular by far is restaurants. So a large number of restaurants have completed. That's the next most popular after other. And these are the ones I would say that have agreed to be published on the website. Following restaurants is retail, and then hotel and lodging, then offices, personal space, then gyms, and the very bottom is grocery and convenience stores. So I think that's also really interesting, and a place for us to focus on, as well as how can we get more grocery stores and convenience stores to also complete. The other thing that we've looked at is, trying to understand if we're getting good representation of businesses across Durham, as we've looked at the self-identification of minority-owned businesses. And of the folks, I would note that, many businesses have selected multiple minority categories, which is, I think, really nice. And we've had of the ones that have completed it, 9% identify as Black-owned businesses. 7% identify as Hispanic or Latinx owned businesses. 4.8% identify as LGBTQ plus owned businesses. And then 40% identify as female owned businesses. So I think there's more that can be done there, and I'd be curious to see how that tracks to our understanding of the general business breakdown in Durham, to see and a good way to kind of figure out, again, which businesses where we really need to focus those targeting efforts. So that's kind of the update on the checklist. And I'm very excited for the sort of media push and the comms push to, because I think that'll also really help, keep this going, keep this alive, and being able to kind of use some of these stats to target the types of, the businesses that we think of have sort of not heard about this yet, haven't participated yet. And happy to receive any questions.
Thanks for that update. I appreciate it. And it's great to hear that we are analyzing the data to try and determine if there's, further things that we need to do based on information. Sorry, I went to mute. Thank you so much for that update. I appreciate it. Any questions for Susan or Muriel before we move on?
No, I want to make a comment, and I think we've talked about this, but we've been visiting Latinx businesses, and I think there is a barrier there for them to fill out the checklist and then printing the posters. So when we visit, we are bringing the posters about the masks, and they are very grateful for that, and we bring masks, but we don't have the capacity to bring like a tablet or something to help them do the checklist. So I think that's something we've been talking about. The health ambassadors will help with, at least with our businesses, because they are interested in doing it. When we talk to them, we bring the information, but then actually doing it, I think is where we get the barriers. So we need to support that.
And Pilar, a follow-up question on that. Is the sense that the barriers are sort of technology, that they don't have a laptop or a computer that they can complete it on, versus the barriers are they get into it and they're kind of confused on what they're supposed to do with it?
I think it's a mix of both, because even I help one filling out the checklist almost step by step, but then at the end they couldn't print anything because they didn't have a printer, or for some of them it's like, I don't have time to do it now, or thinking about getting into the website and doing it. So I think it's also the technology piece. So I think we really, and this is something we see a lot with our community members, but then as soon as they like the idea, and as soon as you help them, they are able to do it. But I think it needs to be more targeted and direct approach.
Sure. So just kind of a solution that maybe we can help with the health ambassadors as well, is that we can create a paper version of it in Spanish that we could basically to help distribute, so that people can do it in paper. They can check it off, and then we can add it into the website, and then figure out a way to print out the signs for them and get them back to them. But just kind of want to throw that out there, that it's fairly easy for us to convert this into a paper experience. There's just then the manual follow-up of we would then have to enter it in on the back end. But wanted to put that out there, and Pilar, we can talk about steps to make that happen.
Great. I think that will work.
All righty, thank you so much. Are there any other updates coming from roundtables?
I had one quick question, Maticia. How is it going with I know we had 1,000 signs to deliver to folks, and just wondered where we were at with giving away the free signs. Let's get back on the bull signs.
We can't hear you, Ryan.
Can you hear me now?
Mm-hmm.
Chair Jacobs, we are still in the process of giving those out. We have given out a fair number of them in Spanish that Pilar has been distributing in the Latinx community, and we've given out a couple of hundred of our English signs, and it's really just a capacity issue. Here again is where, if we can get our ambassadors in place, it will really help with the capacity of visiting restaurants. But we have about half of the signs left to give out, and are working to visit businesses and get out those initial 1,000 signs. So that's the current update. Thank you.
All right, thank you for that, Ryan. Susan, I think you wanted to provide an update on the entertainment.
Yes, that would be great. We talked last week or the week before about forming a small group within the entertainment venues roundtable to help us figure out how to bring meetings back safely to Durham over the coming months. And that group kicked off this week. That advisory group spent a lot of time talking about what events are on the calendar. And of course, for people planning meetings and events, they recognize it's on a week-by-week basis, where they're trying to schedule things that might be weeks or months out, and it's contingent on what the current orders are. So this is all happening within the boundaries formed by the orders restricting group size. But they've got 8 to 10 meetings on the books over the coming months, many of them small. And this group met this week and spent a lot of time comparing notes on how meetings are shifting and operating a little differently. One that I thought was just fascinating was that in some cases they're putting together wedding packages that call for a small intimate wedding right now, and then a party a year from now that would be a bigger event. So creative ways of getting at things. But this group, I think, is revved up to do what we had talked about, which is sharing best practices among themselves. And then for these first 8 to 10 events, having a defined plan ahead of time on what the safety protocols will be, letting the group provide their insights and input into that so that it truly is a sort of community best practice. And then after these events, doing some postmortems and collecting what we learned. As we all know from watching the news, one of the challenges is you can plan an event down to the footstep on how you're going to keep it safe. And then when people arrive, it can be very difficult to maintain that. And so that's one of the things that we need to learn over time. But I think that group is off to a great start, and we'll look forward to presenting those things back. I know that the return of events and meetings in Durham will be one of the, besides the students coming back, will be one of the next areas where we're all going to have concerns about how do we make sure we can do this safely. I think that group may also come back with a recommendation or a proposal for funding around some commonly needed things that would be helpful if they share, like hand sanitation stations and just pedestrian traffic stanchions and things like that. But they're still in the process of talking. We do have some festival representation on this team, and so as you can imagine, there's some venues, brick and mortar venues, where whatever equipment is needed is going to be needed on an ongoing basis once they can have meetings back. But there's some of these that put on a once-a-year festival where investing in new equipment would never make any sense. So we're going to be working on how that needs to come back. There was also some good conversation from the restaurant roundtable. I don't know if Brian wants to comment on that or would like for me to, or if there's someone else on the call who would prefer to. We didn't coordinate that ahead of time.
Susan, go ahead, and I can add in anything that you don't share. That'd be great. Thank you.
Okay. Well, the restaurant roundtable is, we had a small turnout this past week, and that group is moving to an every other week kind of meeting. And there are two things going on that are particularly noteworthy. One is the Durham Delivers program that is being put together as a pilot. And that is supposed to get started Friday and Saturday, where we've got a pilot group of 7 restaurants. There are 20 restaurants or more who have filled out applications to be part of it. And the concept there is that there's a community captain, and certain communities have been targeted, where there's one person who acts as a centralizing force. So everyone in the community is invited to put in an order using the online systems, and then the orders are all delivered to a common place in the neighborhood. The community captain is in charge of making sure things get dispersed correctly to the people who've made the orders. So it's a way for communities to link with particular restaurants or groups of restaurants in a way that's efficient and effective for the restaurants and can help support them. So we're very excited about this, and it's a great example of different constituents in the community coming together to create a technology solution that helps some of our small businesses. So we're excited to see how this works, and then we'll be working on rolling it out. Right now, the push is on recruiting these community captains who can help. So if you think about an apartment community, it's rather straightforward in that there might be someone, a front desk person or someone in that apartment building who acts as the coordinator. If you're talking about a residential neighborhood, single family housing or something, it becomes a little more challenging, but there are already cases where that's been happening. So we're going to be tapping into that. Ryan and Brian, how did I do? What would you add?
One thing I would add is, and I think we'll talk about this a little bit more next week, is towards the end of our conversation, one of the restaurant leaders expressed frustration around the what he characterized as lack of enforcement around the mask requirement, and that expressed that some restaurants wish that there was more of an enforcement mechanism in place, so that they felt that they weren't in the position of having to enforce. And so I'm sharing that conversation. I know that next week we plan to share some of the work that that the city has put together in thinking about enforcement mechanisms, and I think we can talk about that more then. But I did want to at least share that concern that was lifted up as part of the roundtable.
Yeah, and there was, looking at my notes, there was also some conversation about how they wish there was a common place to go to for employee testing when there's someone who is symptomatic. Them having to navigate all the different possible locations and figure out how to do that and how quickly they'll get test results back. And they were saying, wow, if there could just be one dedicated place that serves the restaurant community, for example, that would be really helpful. I'm sure there are lots of people who would feel that way in different sectors, but that's something that's on the minds of the restaurateurs, because they often end up needing to oversee that as employers and to keep their restaurant running. And it's been something of a challenge.
And I will add that staff have been trying to document some of those experiences that we might learn from them, and we'll be able to share that soon, just as something that leaders can reflect on and think about. You know, is there more that we can do to build on all the good work that continue to make it easier for employers to do the right thing? Thank you.
And one other thing I'll add on to is that we also had some discussion with them about the return of students, because we know that many of them will be coming out to restaurants and bars, and what they were seeing so far. And what they've said is that so far it just hasn't been an issue. They're not seeing large groups of students or people who aren't following the guidelines, but we all recognize it's very early. Students are just in the process of coming back. So I think there'll be more conversation around that.
Great. Thank you so much. Really good reports and very helpful. I think Ryan had shared with me just a journey map of one of the experiences of restaurants in terms of the challenges around testing. And I can share that also at the next vulnerable populations group meeting as well, where we've done a lot of work around testing. Certainly have shared that internally as well to see how we can streamline some of our processes around that. Let's move on to some of our discussion topics. We've got two primary discussion topics for today, and I'm going to just do a quick time check. We are at 9:33 by my clock, so we'll move fairly quickly through both of these, but certainly want to give each of the topics time for discussion. So as Ryan said, we're going to move enforcement discussion to next week. So you may have seen that on the agenda, but that is for next week. And then really wanted to get some input. As I mentioned in the beginning, as we were talking about the budget proposals, I think there is general support for this risk mitigation fund, but really wanting to pull together more of the logistics around it. So I would love for us to have a brief open discussion around how we might frame that up, how we might structure that so that it would work for our businesses, but also be able to be implemented from a logistics perspective. It's running one of these funds is not always easy. So would love to understand more about what we think needs to be covered, how that would be covered. Is it reimbursement for expenses that have already been incurred? Is it only for expenses moving forward? If it is for expenses that have already been incurred, what's the date we go back to? I don't think it's back to January, for example, but is it back to May 8th, which is the beginning of phase one, and that's sort of somewhat arbitrary, but at least we could tie it to something date, but wanted to get some of that input from this group and would certainly look to Susan and Geoff and Brian as you're hearing directly from businesses, what you think the businesses are wanting and needing to make this valuable and you know, a big piece of this is making sure that our businesses are able to make those investments in the items that will protect their workers, their employees, and their customers. So I will open it up.
Yeah. Good morning, everyone. As this did arise out of the roundtables, I would note, as was discussed just now, that many have indeed decreased in frequency, but they are continuing to actively communicate amongst each other and with some of us, and are available as these issues come up. It has been good to see that this model, as well as the town halls that we came up with together early on, have expanded to increase public confidence and direct engagement in this group. I think that we are looking into how to support some of additional conversations moving forward, and we'll look forward to that. But on the budget ask, I do want to take this opportunity to really clearly and publicly thank the city council, the county commissioners and staff, as well as Duke and the corporate community for the various financial needs that have been supported throughout these several months already, particularly those in recognition of small businesses and organizations' role in our communities as employers, taxpayers, and service providers. I want to note that unfortunately local programs have been the only lifelines for some, and some entities remain unserved and are still pushing ahead as best they can. And so we just appreciate the continued work on this and the thinking about going back retroactively, noting that many have indeed already made some investments to try to keep themselves and the community safe.
Thanks, Brian. So what do folks think in terms of being able to go retroactive? We really need to, we've got to frame this up and be able to present something back to the city council in the next 2 weeks. So would like to have, let's get into a little bit of detail here if we can. What do folks think is realistic?
I think we heard a conversation about reallocating some of the loan money to this risk mitigation. I would say that that might be too soon of a conversation. You don't know what you need until you have been working through some issues for a while. So to have the loan program out there and then say, okay, well, we're going to take the money back because we didn't use it all in this amount of time might not be the best course of action. I would say, if at all possible, to leave that open a little bit longer and let that money and let that program, as it was established and as it is running through the Carolina Small Business Loan Fund, continue to operate. And those businesses that may find out in a month's time, oh, that really would be helpful, could apply. Additionally, I would say whatever this risk mitigation looks like needs to be very specific and separate from the loan program, so there is a lack of, there is less confusion. It's one thing to push out a lot of assistance, but we have to be very clear what the assistance is trying to address so that the businesses aren't having to go through and read and go, well, how is this different from what that is? That's something we heard with the PPP and the EIDL. What's the difference between the EIDL and the PPP? Which one should I apply for? Can I apply for both? That raises that question, that if you leave the loan program open, could a business apply for both? Could they come in under the current loan program and get funding, but then under this new risk mitigation get funding for something different? I'll be honest that I haven't looked closely at the funding proposal that was submitted to the city and the county, and I texted Ryan. He and I are going to talk next week, so I can delve a little bit more into it. I've been out of pocket, so please forgive me for not being involved in these meetings over the last couple of weeks. But those are just my initial thoughts, my initial gut reaction as I start hearing this conversation. Let's not be too hesitant to take that loan funding away that currently exists or change that around. Let's look at, is there a way that we could create an additional program that is addressing very specific concerns and issues that the small businesses are facing.
Okay, thank you. Do we understand what the barriers have been to applying for the loan program? Is it that maybe just the need for it hasn't arisen yet, and so there may be a need a month or two from now? Or are there, I've certainly heard the question around the threshold for number of employees, that's a pretty low threshold, or max ceiling, really. You can't have more than 25 employees, I think, to qualify for this. What are the barriers that we're hearing?
One barrier we heard, and we worked with the city to get some wiggle room, so that's been helpful with this program since it was so new. As you all know, the Brightleaf District had the gas explosion just a year ago when the pandemic started. And the requirement to have 2 years of profit pretty much cut out all of the Brightleaf District businesses, and especially those that were directly impacted. And working with the city, when they came up with phase 2, they removed that if you could provide documentation of why you were unable to show profit, they would deal with those on a case-by-case basis. So that was one thing that we've gotten removed. I have heard that for some of our restaurants, the employment number actually prohibits them from coming in because some of them have more than the 25 limit, I think. So some businesses haven't been able to because of that. And again, I'm speaking just for the downtown area. I would say that it might be a matter of this program rolled out when businesses were trying to get back on their feet. So we were opening up restaurants and people were trying to start their business and taking the time to sit down and do an application. That's again why I say let's let the loan program stay as it is. So as people start dealing with how do I do outdoor dining, they can also look at this loan program and apply for it as they have time. I think Pilar mentioned that a lot of businesses just don't have time. So much is coming at them right now. So much, they're doing so much and they're just trying to stay afloat that they're picking up doing a business loan application when they can. And a shout out to the SBC, LaShawn and Latasha Basgatti and LaShawn Harvey and all the work that they're doing for our small businesses to help them, not just with the local program and working with Carolina Small Business Loan Fund, but all the help they've done with the federal program. But there are two people and there are a lot of businesses. So perhaps that's a long-winded answer to the need for more help to get businesses to understand the requirements for all of these different programs and which one is best suited and how they work together.
Okay, thank you.
Promise I won't say any more.
No, this is really helpful. Thank you. Geoff, Susan, anything else to add?
Well, I think
I'll just say that I'm hearing a lot of the similar cases that that Nicole alluded to. It's just you're in a survival mode and you're just being pinged with constant information and relief and at some point kind of becomes a bit just overwhelming. So I would agree with Nicole that we should not try to alter what we already have in place, but really think more about sort of adding on what the next pieces. And as far as Katie, your question about making it retroactive and the timing of that, I'd have to give that a little bit of additional thought, but I do think keeping them separated is the existing loan pieces as well as whatever new sort of mitigation we can come up with is important. I think that's the one concern that I've heard was, and I think the city's done a great job of addressing this, is that a lot of the small businesses that were denied weren't showing the correct amount of loss over the past quarter. And I think the city's made some adjustments to that. So more of those companies that maybe weren't eligible under the original framework can get some measure of assistance there too.
Now, I would be supportive. I thought the idea of making it retroactive does make sense. We certainly don't want to penalize the businesses that were the most timely and responded with the most urgency in putting some things in place. I would assume that what we need to do is have some kind of a scoring rubric for how we decide which businesses that allows for the funding to be distributed equitably to different businesses. And I also wonder about, we haven't directly talked about this, but it may be assumed about whether we are going to focus on businesses that are customer facing, that have a where it's a customer interaction issue, versus office buildings, for example, that could put up plexiglass between every workstation. But is that where we want to spend this money? So I'm not sure I haven't thought through it enough to know what is fair. But I'm thinking about the restaurants and customer service, retail, those where you have customers coming in and there's such a risk to the customer and the staff that there's a real point of concern there, and businesses where the work cannot be done remotely, which again goes back to distinguishing perhaps between office workers who often can work remotely and those that have to be in place. But I think that kind of the thought process about how do we perhaps assign points for some of these different concerns so that we have a clear and fair process for allocating funding would be very helpful.
Thank you.
It's a great point, Susan. So much of the feedback we get are from the office users, and they're, can mobilize and work remotely pretty easy. That's a really good distinction you made.
Thanks. Mayor Schewel.
Thank you so much. This has been really useful. I really appreciate all the points that have been made this morning. Two things that are on my mind that I hope the group will think about. One is who will administer this? There needs to be, we have the Carolina Small Business Development Fund that's got the grant and loan fund. But I think that if a discussion needs to happen soon amongst the people who are working on this about who's going to administer this program and how will that work. And then another thing on my mind is something we've talked a lot before, and the more I hear, the more I am thinking about this, which is a lot of the things that we know that people want, especially the most basic things, hand sanitizer, face coverings, and so forth. We don't want people, I don't think, to have to go through applying for a grant to get them. I think that I hope the group will also think about funding for a supply of these things that people can just come and pick up. I'm not sure how it would work, but some kind of warehouse situation that people don't have to go through a grant process to get what businesses don't have to go through a grant process to get what I think are some most basic supplies. And maybe that could even include plexiglass. I'm not sure how that would work, but certainly for the hand sanitizer, the cleaning supplies, which, Lois surfaced the idea of the cleaning supplies quite a while ago, and the idea of having a supply of those for businesses and institutions, and then the hand sanitizer. So those are two things on my mind, and I hope the group will think about those.
Excellent. So who is going to, I guess, who wants to work on this? Because I think we need a group to fairly quickly mobilize offline and pull together these criteria and help us answer some of these questions around who would administer, et cetera. So I'm going to ask for volunteers, otherwise we can voluntold.
Katie, while giving people an option to consider that request, there's one additional layer that I want to add on, and that is, might this, if we're going with a grant program or some type of risk mitigation fund, do we want to extend it beyond businesses? There was a lengthy conversation in the city council meeting about whether or not this would extend to nonprofits and places of worship. It certainly legally could. And so I think that there is some need to consider whether or not the things we're talking about are just for small businesses, or we're extending it more broadly to establishments in Durham who might need this type of support.
Well, until Ryan said that, I was going to volunteer, but now he's added that on, and I don't know. No, I'll volunteer to help. I will say, though, that Duke has its nonprofit fund that it is providing money. So if we are to extend this to nonprofits and places of worship, we need to then pull in the Duke fund and make sure that we're not overlapping, or if there's a way we can piggyback on what they're doing. Again, the point of not making another program to confuse the nonprofits and the churches. If we do nonprofits, the immediate reaction is to always do the 501c3s, recognize that there are 501c4s and 501c6s that are doing great work for the city and in the city. So I throw that out there. That's usually difficult because of the ability to lobby. And I know that there is sometimes a hesitancy, but, and I'll be very transparent, we're a 501c6, but I know of others who aren't getting the support that we might be getting. But I'll volunteer to work with Ryan and Brian on that.
Okay.
I'd like to echo what Nicole just said. I think if this is going to be a grant program, I think we should include nonprofits as well for a number of reasons. And I served on the grant panel for the first round of nonprofit giving that Duke did. And there is always gaps and shortages. There are always more needs than there are funds to go around. So needless to say, there were a lot of excellent proposals that could not get funded through that. I agree that we should align and collaborate, learn from, best practices already out there. But I do feel strongly that if it's going to be grant dollars, that nonprofits and faith communities should be eligible as well.
Okay.
I was going to take a pass on this, but since Nicole's in, I'm in.
Sounds good. Thanks, Geoff. All right. The other item that we have, and I know we've got just a few minutes left, but we talked last week about how do we proactively engage our university students and really engaging the students in this work and creating a roundtable. Would love if folks have given any additional thought to that and how we might structure it. Certainly would welcome a few minutes of discussion around that. And if folks haven't had time to give that thought, we can table this till next week, but I do think we want to try to get this up certainly by early September, I would think. I think we need to give the students a little bit of time to get settled in the next couple of weeks, but certainly by end of August or early September, trying to stand up some type of roundtable for our students, I think would be helpful and would really help inform this group.
Well, Katie, one thing that we have talked to the new president of Durham Tech, J.B. Buxton, to the Duke administrators, to DPS, and to Dr. Akinboyo about having student representation on the education roundtable. If we're talking about a separate student roundtable, which I think is a great idea, I'm certainly happy to go back to them and start those discussions. And I'm sure Wendy would be as well. So I think if you want us to do that and talk to the education institutions to get going, I'm happy to volunteer to start that.
What do you folks think about the idea of the concept of a true student roundtable versus, and I may have misunderstood from last week, a student roundtable versus just including student representatives on an broader education roundtable? Any preference for one over the other?
I suggest it be joint because I think, I guess, having the actual administration leadership for each of the institutions with the students, I think will help facilitate even conversation between, the students and the administration too. I think we get the added benefit of that type of collaboration. So I would suggest that we ask each of the schools, each of the educational institutions to appoint both types of representatives to the roundtable. And I actually feel like this is really important and that Steve and I could work on outreach about it because I think we want to get going on this pretty quickly and, get them involved with let's get back on the bull and all the other things that are happening, as students are coming back onto campus.
Excellent. All right. Well, thank you. So if you and Mayor Schul will work on that together and let us know where you need our help and our support in that, that would be terrific. But would love to get that started. Excellent. Anything else to come before the task force this week? Okay. So we know next week we will have discussion around compliance and enforcement and further discussion on that. We'll get some additional roundtable updates. If you have other suggestions for agenda items, if you can get those to Ryan or Maticia or myself preferably by end of the day on Tuesday. We meet on Wednesdays to review the agenda, so that would be helpful. And if there's nothing else, I just want to thank you all for the continued incredible work. Again, we are making such really good, significant progress and making a difference in this community that we love so much. So thank you all. I hope everyone has a great weekend.
Thank you, Katie.
Have a great weekend.
Bye, y'all.
Bye.